Welcome to my YouTube channel. Today we're going to talk about the grades of preeclampsia. Kindly make sure you subscribe. It will cost you absolutely nothing. Let's dig in. So grades of preeclampsia. Grades of preeclampsia are defined according to severity, and we have two grades of preeclampsia: preeclampsia with severe features and preeclampsia without severe features. So the severity of preeclampsia can be graded by diastolic and or systolic blood pressure, the amount of proteinuria, signs and symptoms of severe features, lab results indicating liver, renal disease or clotting deficiency, and presence of a convulsion. In the presence of a convulsion, that we will grade that to be a eclampsia. So mild preeclampsia or preeclampsia without severe features is when you have a diastolic pressure of 90 to 109 millimeters of mercury, or a systolic blood pressure of 140 to 159 millimeters of mercury with proteinuria. So I hope you have gotten that. The ranges, that is 90 to 109, 140 to 159. So if it goes beyond that, then that is called severe preeclampsia with severe features. So preeclampsia with severe features or severe preeclampsia can be defined by any of the following: where you have a diastolic blood pressure of 110 millimeters of mercury or more, and or a systolic blood pressure of 160 millimeters of mercury or more on two occasions 4 hours apart. So, or when you have a diastolic blood pressure of 140 millimeters of mercury or more, and or a systolic blood pressure of 170 millimeters of mercury or more on one occasion. So the difference between these is you have 110, 160, but on two occasions, 4 hours apart. And the second one is when you have 170, 120 on one occasion. So, and the severe features which we are going to see in the next slide: abnormal laboratory results indicating severe disease. And these abnormal laboratory results are usually involving the platelets, the liver, and the renal. So a serum creatinine of 90 millimoles per liter or more, indicating abnormal renal function. So in preeclampsia, we are going to have reduced GFR, and if you're going to have reduced GFR, then you are not able then to excrete creatinine or urea. So increase of creatinine greater than 90 millimeters of millimoles per liter or more, then it's an indication of abnormal renal function. Or an alanine aminotransferase or aspartate aminotransferase of 40 international units, indicating liver disease. Or platelets less than 1,000 100,000 microliters. So the severe features or the severe features that we're talking about, we have signs and we have symptoms. So you can categorize them from head to toe, where in the head you're going to have headache, you're also going to have blurry vision, you're also going to have visual or flashes of light in front of the eyes, blindness, among other factors such as altered mental status. So when you go downwards, you're going to have pulmonary edema, and that may be seen as dyspnea. When you go downwards, you're going to have epigastric pain, that is in the liver. You're going to have epigastric pain. And then when you go downwards into the kidney, in the kidney we said you're going to have reduced GFR. So that will present as oliguria or anuria. So this suggests some of the severe clinical features, and they include severe headache, visual or flash of light seen in front of the eyes, blindness, dyspnea, altered mental status, upper abdominal pain in the epigastric or over the liver. And then signs include tenderness over the liver, increased tendon reflexes. These are knee reflexes and clonus. Then you can have pulmonary edema and ascites. So the severe features of the CNS include blurry vision, scotometer, altered mental status, severe headache, and revealed by acetaminophen. And then we have symptoms of the liver capsule distension, which include epigastric pain or right upper quadrant pain, nausea and vomiting, and elevation of the liver enzymes, that is AST and ALT, greater than 2 times the normal. So systolic blood pressure, which you have seen, which will define it as greater than 160 or 160 to 110, sorry, on two occasions, 4 hours apart, or 170, 120 on one of the occasion. Platelets you can have less than 1,000 count. Urine output, we said you're going to have oliguria or anuria, that is less than 500. Then pulmonary edema, which can present as cyanosis, stroke, and progressive renal insufficiency, which we said you are going to have reduced GFR, therefore presenting as such. So urinary creatinine to be greater than 1.1 milligrams per dl, or doubling of the serum creatinine in women without renal disease.